Okay, so doing the evaluation, we're going to use a product that's called off-the-shelf fat or donor fat. It comes from cadavers. It's processed. It has no cells or DNA in it. And basically what it does is it helps you grow new scaffolding, new tissue on top of your current tissue. So within about 8 weeks, you'll start to develop new fat cells, new blood vessels, and new collagen. So those words are big words: collagenesis, adipogenesis, and angiogenesis. The problem with fat transfer, it doesn't have a blood supply, plus it's very expensive. So if we take fat from here, put it in your face, it lasts about 3 years. This is greater than 5 years because it's a living organ. Okay. So what we were doing in evaluation, we're looking at all the wrinkles here, we call them curtains, in the sides of the cheek. This is basically loss of collagen and fat. And so we're going to numb you here with a little bit of lidocaine, and then we're going to take our syringe of Renuva, and we're going to put little toothpick lines right across here, this way, in this fashion, and build a bridge. And then we'll take another syringe and we'll do the other side, okay? In 6 to 8 weeks, you have to have some patience with this. 6 to 8 weeks, it's going to start making new tissue, okay? And then we'll do a follow-up maybe in 6 months. So the only disclaimer I have is that in 5 years you may age, and so you may need another syringe down the road. I always tell people that, because the only really super permanent thing is silicone, which I don't use. And so this greater than 5 years according to the FDA study. After 5 years they say it's permanent. Here's the consent form, just like we said. It's an allograft, meaning it comes from a different person, adipose matrix implant. And it's biocompatible, and it's a tissue product, and it explains basically where it comes from. It's very, very safe, and the FDA has approved it. Okay, so certain risks: you can get some swelling, you get redness, comfort, bruising. One of the things I tell people is that you're going to get a little bit of an inflammatory reaction, which is what we want. And so the inflammation is what starts creating the new tissue. So after 24 hours, you can use cold packs for about 24 to 48 hours if you have any pain. Today, just, you don't have to do a lot, but just kind of hang out and you'll be fine, okay? I recommend, and this is my thought, that you not take Motrin or ibuprofen or anything like that, because that's an anti-inflammatory. So use the cold packs. Just don't put a lot of pressure on it, like snorkeling masks, or if you get a massage in 2 weeks, you can do whatever you want. Okay. You can feel little bumps because it's new material. They all go away in 4 to 6 weeks. The other thing you're going to do is you're going to massage your cheeks for 5 minutes twice a day for a month. Okay? If you forget, no big deal. Just do it during the day. You can use aloe vera, you can use your creams, you can use whatever. All right? And it's up to you when you want to do it. And you're not on any fish oils or anything like that, aspirin?
No.
Okay, good.
So you said twice a day for 5 minutes?
2 times. 5 in the morning, 5 at night. Okay. Some people, do it while they're doing their face stuff in the morning. Some people do it in bed at night. Some people, some people use creams, whatever. It works. So for a couple of hours today, don't put anything on there, like makeup or anything, because those holes take a little bit of time to close. All right. So I'd pretty much stay makeup free today. All right. And that's it. And so I'm going to take some pictures. And do you have any questions?
No.
Okay. So I'm going to let you read this. You put your X wherever you want it to be. So this is the mixing process of Renuva. This is the Renuva here. And loosen it up a little bit. So it's dehydrated in effect. And then we take saline and we push the saline into the product and we hold it for maybe 5 to 10 seconds, and then you can see it start to hydrate the entire product up with the saline. So now that it's loose, it can mix very easily with the normal saline that we put in there. Then little by little, we mix back and forth until the entire product is in this syringe here, and then we give it a couple of really good mixes, and we're done. That's the whole mixing process. Okay, so I'm going to have you turn your head this way. If you want to lean your head back, more comfortable. Little sticks.
Relax.
What we're going to try and do is kind of push it up into that big hollow there, right here. We're just going to put little toothpick lines down like that. Doing all right?
Mm-hmm.
It's one of the smoothest products I've used compared to some of the other materials. This might tweak a little bit here. That side's done.
Wow.